Welcome, guys, to another YouTube video for the IMG series. Today, we're going to talk with Dr. Roynny Sanchez. He's a PGY5 and the chief resident of our residency program at Larkin Community Hospital. And today, we're going to talk a little bit about his story, his personal story, and we're going to share and answer some questions also for you guys, especially now that we are in the interview season and the match season for the next year for 2025, and we are very excited about it. So let's start, Dr. Roynny. So first of all, thank you for joining me in this YouTube series, and thank you for being here.
No, absolutely, Jesus. So thank you very much for the invitation again. So it's my pleasure to be with you guys today. So, Jesus and me, we have a good history. We went to the same medical school in Venezuela. Okay, so for multiple reasons, I was the first one that came here to United States. I started residency, and I was so happy when he just made it in the same program that I am. Okay, so I will be, one of the person that is gonna open the doors for multiple people that will be interested to do the same journey that we made. Okay, um, absolutely. So I'm here.
Okay, so this is a very special interview for me because Ronnie was, I always tell you guys it's my story, my personal story. I always telling you guys that networking for me is essential, and that was the reason I got an interview and pretty much the reason that I matched. And one of the key person that got me or helped me to get an interview here was Dr. Sanchez because I know even though we are from the same med school, we were not super close friends. We know each other, of course, because we were doctors. We were from the same medical school. We shared different moments and places in Barquisimeto, Venezuela. And then here, of course, I contacted him. When since he started his journey, asking him what to do. He was kind of one of my mentors as well. He gave me a lot of advices, like many other doctors. And I kind of follow your path, right? And I'm here now with you. I'm very humble and very happy about it. So I want to start talking about a little bit about networking and connections.
Cool.
I think it's very important for all IMGs to know how, because you did the same. You of course
Yeah.
you created connections. You
Correct.
in your work, in your jobs before. So I want you to to tell us a little bit about your story, the things that you did before you match,
Okay.
and how important was using connections and networking to get an interview or to start to being able to match in the residency.
Absolutely. So let me start with a little bit of, my personal history and before came here to the United States. So we usually say that this is like a reborn. So we just born again when we came to this country. So we already know that this journey is not easy, but it's not impossible. That is one of the words that I like to use. Okay, so and I encourage everybody to do it. So that as mentioned before, so we went to the same medical school. It was in Barquisimeto. Then I moved to Caracas to do my specialty, that it was general surgery. Okay, and I did a little bit of additional training trauma surgery. So then I practiced a couple of years before made the decision to came here to United States. Okay, when I came here, so all this background usually help us. Okay, every international medical graduate has the same or similar history. So to try to integrate us to the medical or the healthcare system. Okay, so I'm gonna start with a more low level. So my first job in the medical system was as a medical assistant. That is a simple certification that you can get it just with your medical diploma. Okay, your medical degree. You show up there many institutions that they can provide you that certification, and after that, so you will be able to just start finding a job and start getting a little bit, in the healthcare system.
Correct.
So I worked like a 1 year as a medical assistant. Then I had the opportunity to work in a good medical system in Miami, that is my Memorial Healthcare System, as a first assistant. So that, at the moment that we share similar history, so
Yeah.
we work as, in my case personality, I work as 5 years, like first assistant. Okay, so I had opportunity, to integrate.
Surgical first.
Sorry, surgical first assistant, correct. So I had that amazing opportunity to share, with another surgeons, okay, multiple specialties. But at the same time, I start developing the networking, okay? So what is the way to develop that networking? Essentially just showing your skills, because you already had training, so you came for an amazing universities around the world. Okay, when you came here to United States, you need to show up yourself, right?
Correct.
So I started developing my networking, and at the same time, at the moment that I was working, I was studying for the USMLE. Start, all this process, taking step one, step two. I remember at that time we had to take the steps to CS, the clinical skill. That is not anymore a requirement for the certification. And finally, the day of the application for the match arrived. Okay, so just to get it more close to the dream to become a surgeon again here in the United States. So I matched in my second cycle. So I didn't match in my first cycle. And I will tell you, later a little bit my recommendations and the mistake that maybe I made in my first cycle, and maybe that was the reason that I didn't make it. Then in the second cycle, I just improve all those weaknesses that I have in my first application and finally match. Okay, networking absolutely is one of the keys. Yes. Okay, to match, especially for international medical graduate like us. Okay, but additionally, you need to work a little bit on your resume, do a good research in the places that you are planning to apply. How much is the percentage of IMGs or international medical graduates that they have, et cetera, et cetera.
Exactly. You said something very important, which is how to do networking on the places that you are working, and you said that you were showing your skills, and I call that like lead by example. You were showing your skills instead of saying that you have skills.
Nah, yeah.
You just were so that's taking action. It's much more important than just saying stuff. So
Correct.
sometimes, and you did the same, because it was a before and after you match here, because before you, all of the previous graduates were not IMGs, right? And after you, because you did a great job, then we started getting more IMGs.
Yeah.
So you were like a stone that made the change for others to start matching in this, and that's the same that guys should do when you go to a program. When you match, you need to be the best. You need to do a good job, because behind you will come more people, and that's what happened.
Correct.
And now, person like us with previous experience that you call all graduates could have the opportunity to match in program like ours. That this is also for people who does not have experience in the surgical field, like let's say a person that already have a residency, but it could be for persons like we also have persons that had preliminary years and some experience, not necessarily a postgraduate experience. Right. So that's something that I really wanted to mention, because you could be that stone that changed the path
Absolutely.
for others. So
Absolutely.
it's very important.
Yep.
So let's go back to that moment. We're in the cycle of matching.
Yes.
So you mentioned something very important, which is that you didn't match on the first cycle.
Correct.
And you matched on the second cycle. So what are the things that you believe that were probably mistakes that you made?
Okay.
And what did you change, or what did you improve in your CV?
Correct.
To go and match on the second cycle.
Correct. Yeah, no, that's super interesting, because you hear multiple things where you are here, especially when you're planning to apply for residency. So it has an opinion, and it's hard to follow every single opinion, right? So at the end of the day, so you need to pick the good stuff and unfortunately just discharge the bad stuff. So, but one of the things, and I just honestly suffer by myself, it was so to present your application, we know all the board exam already passed. So let me explain a little bit about it. So I remember, and I already told you, so the first time that I just present my application, I already passed in that moment the step one and step two CK, but the step two CS, that it was the test that I used to take in the past, so the score was pending. Okay, so That means that at the moment that I just submit my application in the match system, so I didn't have the certification as a
Okay.
IMG, okay, in file. So it was pending because so you need to get that score for the second, or
Mhm.
the second part for the second step, the clinical skill exam, to be eligible for the certification. So many people say, hey, I think it's not a good idea. So you need to get the certification before to
Correct.
submit your application. If not, so the program directors and programs, they probably just gonna discharge your application. They say, no, maybe this guy, probably he won't pass the exam, or they are not completely sure that you're gonna be that candidate that I will make it at the end of the day.
Correct.
So that's one of the mistakes that I made. Okay, and that's why I encourage every single candidate those days to complete, okay, all the process before submit the application, because that's going to open more doors at the different programs that you are applying. Okay, I will say that is an strict requirement, because it's not. So the only requirement that you need is at the moment that you submit your ranking list. That's the moment that you have to get complete all your profile. Okay, so
Correct.
that's by paper. Okay, so that's that the system said, but in the reality it's different. So if you didn't show up with your profile completely fill it, so probably program director, they won't see your application, and you're gonna unfortunately waste time and money. Okay, so that's one of the mistakes. The other, I won't say a mistake, it was more like improvement that I made for my second cycle, is to take the step 3. So when you already certified for the education committee for international medical graduates, so you has the chance to take the step 3 even before the start residency. That is an advantage that we have versus the U.S. grad. So U.S. grad, they need to practice at least 1 year, okay? And the way that they're gonna do is through the residency to be able to take the step 3. So in our case, we are ready to go. Yes. And that's gonna improve your application a lot, okay? Because believe me or not, so there are people that they are close to finish residency and they didn't take the step 3.
And this tip or this recommendation, I think, is very important. For surgery residencies, yes, it's very important. But I think it's even more important for medical residencies because the residencies are shorter, as
Correct.
3 years.
Exactly.
And it's risky for program director to take a resident that you don't know if he's gonna pass the step 3 or not. And remember, everything is, if you have a resident that do not pass the board or is not able to pass, it's gonna change everything for the program. The program could have a red flag, then it could have ACGME involved. It's gonna be a problem for the program. So if you already have that step 3 passed, it will help you a lot.
Correct. You're gonna be like a unicorn. So everybody's gonna be looking for you because it's a less headache in the process. Okay. So the other thing is you have the chance to do a little bit of research. Okay, when you are here, so simple research. I know, say like a prospective cohort or case control case. No, we're not talking about it. Just a case report. So case reports, they are easier to make it. Okay, easy to publish, but that's pretty good for your CV, for your curriculum, right? For your resume. So that's the other improvement that I made, okay, versus the first and second cycle. And absolutely, reinforce my networking, okay? Uh, Probably another thing that you heard a lot is just do the research of your programs, okay, or the program that you're thinking you're gonna apply. What that means. Essentially say, okay, what is the percentage of international medical graduate that they have, okay? Additionally to the good stuff, like, oh, you're planning, for example, general surgery, or that program has robotic experience, or you're planning to do a trauma surgeon, or it got a strong trauma surgery core. Additionally of that, so the research that you have to make is to see how how what is the chance that you're gonna have to make it in that program, okay? And the best chance is when they are IMGs. So as Jesus said, I remember when I applied here, So this program, Larkin Community Hospital General Surgery program, used to be a DO program. Okay, so every single resident, it was a DO. So for the people that doesn't know about DO programs, so United States has like a two different medical school. This is the simple way to say it. So one that at the end of the journey, so you're going to become a medical doctor. That's why we weren't called like MDs. Correct. And the other one, you're going to be a doctor in osteopathy. That means DO. Okay, so they have a little bit like a chiropractic stuff additional to the medical knowledge that you have in medical school. So that is the difference. This program used to be a DO, so they don't have any MDs. And now I usually made this a little bit joke that we were the experiment. Okay, so we were my co-resident, Dr. Soto, Alain, the other chief. So we were the experiment. We were the first MD, starting from the beginning. So we have a professor that she was an MD, but she came for another program and she jumped directly to the third year, if I don't remember. So she's already graduate. And she was like the official first MD, okay, in the program. However, so Soto and me, we were the first MDs starting from the beginning, okay? Yes. And that's, as Jesus said, so I think we made a good job because, behind us has been a lot of MDs in the program. In fact, I think the only DO that we have right now is in second year. Sorry. No, he's MD as well. No, Daniel is MD. So I think right now, so we don't have DOs. Okay, so many people say, okay, so but what happened now? So we are just charting DOs? No, that's not the idea. So we are open for everybody, everybody, absolutely. But by chance, or maybe by example, so we are showing that we can make a good job, and here we are.
One of the questions that I always ask to all the residents when I'm interviewing them is, to me, I think I always say networking is very important, but also there's a other part that a lot of people forget or do not look for it, which is, when you are in troubles, you usually ask for help, right?
Sure.
But sometimes we believe that as doctors, we know it all. Like we are the best, and whatever is my plan is the best plan, regardless anyone else's.
Gotcha.
Right? But then I learned that, especially in this country, but I believe everywhere, tutoring and mentorship is very important. Having somebody that supports you, that give you ideas, kind of give you, you should follow this path. This is the correct way. This is the incorrect way. I recommend you do this. I recommend you to not do this.
Sure.
To me, it was very important. You were one of my mentors. I have several mentors for different things in my life.
Correct.
Personal things, professional things, even therapists if you need help on your mental health. I think that's very important for personal and overall growth.
Absolutely.
So do you use mentors or tutors in your journey, and did that improve your ability to match?
Yeah, absolutely. In fact, remember, majority of INGs, I will say close to the 100%. So English is not the first language, and we have to do multiple things in your application, like personal statement, even prepare for the interview. Okay, so the mentorship is a key, because they're going to help you to develop your personal statement. They're going to help you. They're going to prepare you for the interviews. Additionally, they're going to open doors, okay, in the networking, okay. They're going to guide you, okay, for the way that you have to go through, okay. So try to avoid, maybe mistakes that mentor make in the past. That essentially happened to me. So when I had somebody over my wing, trying to teach anything that I learned from this journey, and try them to avoid the mistake that I made. Okay, and that is the more important thing about mentorship. Okay, so I really encourage everybody to try to find that person that is going to guide you to this process. Okay, and that's going to additionally help you sometime to get inside that program that you are fighting for.
Perfect, amazing. So another question is, you are now in a position, you are a chief resident, right? So you are in the position of selecting future applicants, current applicants to be future residents.
Correct.
right? Right now, I can say our program has more than 1,000 applications, and
Yep.
we only select two people,
Yes.
right? So the interview, it will be, we haven't sent any interview just in case, but soon they will be sent. So what are the things that you look when you are interviewing a person? Because this is a question a lot of people, what are the things that you look for? What do you want to see in those applicants when they're sitting behind the screen? What are the things that you look for, or what are the things that to you is not a good thing? It could be a red flag. I don't
Gotcha.
like that thing.
Gotcha. Yeah, no, that's really interesting question because that every single person that approach you, they have the same concerns all the time. So one of the things that maybe you heard that multiple times
Mhm.
is try to get contact, okay, with the residents and the faculties in that program that you are interested to go for it. Okay, so one of the ways that you can do that is absolutely doing observership or rotations in that program. So I'm not gonna say that's gonna be the first thing that we're looking in our applicants, okay, in our candidates, to make sure that they made a rotation here, they know how the system work, okay. So what is they gonna be comfortable in the environment, okay, or the residency. So that's one of the things that we're looking for right now. So if the candidate made a rotation or not with us, okay,
Mhm.
it's no, you won't be excluded if you don't made it, because I know some programs you need to pay for it. So we completely understand that,
Yeah.
okay. But if you have the choice, or sorry, if you have the chance to do it, so I really encourage you guys to do it, okay. Rotation is one of the things. So second, another situation that maybe you heard multiple times is the scores, right? So
Mm.
scores matters, okay? But I think more of the scores is the pass fail situation. So if you fail a test, sometimes make your journey a little bit difficult.
Yes.
However, so don't give up, okay? So because probably you failed one test, but you have another positive stuff in your
Correct.
curriculum, and if you have connected with the new networking, so I can guarantee you that you will make it, okay? Absolutely. If you didn't fail any test, so you're gonna have a little bit more chance to over the other ones.
Yeah.
But that I said before, please don't give up. Don't give up. Don't say, "Oh, I failed this test, so I never gonna make it," and the residency that I was dreaming for. No, no, no. So those clean it out your mind about those bad
Yes.
thoughts. So I'm pretty sure that you will make it. The thing is, you need to reinforce your curriculum, your application with another stuff. For example, if you didn't take the step three,
Mhm.
go for it. So take your step three. Okay, so maybe I failed this test for whatever reason, but
Mhm.
hey, look, I had the step three already passed. So you, program director, so you don't have to be worried that I will
Exactly.
miss this test or I will fail this test during my residency. And that's gonna become negative numbers in your program. This you see, this is the way that you're gonna handle
Exactly.
that situation. Okay. So this is the two more important things that we are looking for right now. Okay. So you made a rotation,
Mhm.
if you fell unfortunate or not, um, a test. Okay. And networking. So networking is the key.
And
Networking.
what about during the interview? Like you are interviewing a person right now,
Okay.
and because interview prep, I think, is very important because you can,
Sure.
it's the only, especially if you weren't able to come and rotate with us. So we I don't know who you are as a
Sure.
person, right?
Sure.
So you only have 15 minutes to show yourself.
Correct.
So, what would you say? What would you tell? What would you like to know from that person in 15 minutes that you don't know before? What would you like to see?
Perfect. Yeah, no, that's important. So the first thing that we're looking in a person is to be humble. Okay. So doesn't matter that you were the head of the department or in whatever hospital around the world. Okay. So at the moment that you came to us in an interview season, so you need to show yourself that you are humble enough to be a resident again. So
Mm-hmm.
even that you were an attending for 10, 15 years. So right now you're going to spend time with us as a resident, okay? And you
Correct.
need to show us that you have the capability to switch, that cassette that maybe we have in our minds. So remember, I wasn't attending one time as well, and then just studying
Start
again
from
as a
scratch.
residency, as a resident, correct? So this is one of the things that we're looking for. So the other thing, I will say, try to define yourself in the simple words. Okay, so don't elaborate too much
Mm.
about your history. So I don't know, you catch up when I just mentioned about maybe you failed this test.
Mhm.
So immediately you're gonna say something about, oh, but I had the step
Exactly.
three, and this is essentially the good positive vibe that I have for this program. So I didn't make an excuse why I failed. You see, so that's the tricky part that you have to learn to play, because we are not looking for excuses, right? So
Exactly.
if somebody, everybody's human, everybody has problems in their life, so you can fail, for example, a test because you have a really critical family situation, but during the interview, it's not the best time to show how vulnerable you are in that
Hmm.
situation, because they look in a person that they can handle difficult situation without left without tension your job at your you know or whatever task,
Responsibilities. Yeah.
responsibility, or whatever task that you ask for. So that's really important. So don't make excuses.
Hmm.
Okay, elaborate a little bit your history. Um, if you have to justify something, try to do it in the best way and the humble way all the time. So I think with these three topic or three ways to approach during the interview, you're gonna success, honestly.
And I also recommend, for those that does not have experience, because if you have experience and you come here, you need to be humble enough, as
Sure.
Roynny said. But if you don't have experience, we want to see proactivity. We want to see leadership. We want to see confident person. We want to see a person that is secure of themselves. That when we ask you something, you immediately answer in a clear and a straightforward manner.
Correct.
We don't want going around spinning around the answer and you're not completely sure what you're saying. That make me believe that your process of thinking is not ready for a residency, especially in the surgical
Oh
specialties.
yeah.
Surgical specialties, we need to straight to the point, clear, very clear, and direct, concise. So that's are the kind of people that the kind of, I would say, is like a surgeon kind of skill,
Yeah,
surgeon kind of
personality, something
personality.
like that.
So you need to perform in your interview as a surgeon, like you are one of us.
Correct.
Okay.
Correct.
That this personality could change from specialty.
Correct.
Some other specialties you could show more, compassion, more empathy, more, be a little bit more, open-minded, etc. So it depends which specialty you are applying for. But surgeons, we are just like
Yeah,
that.
and especially for surgery, let me add that, Jesus. So you have to be real, okay? Because sometimes, I remember when I was interviewing, my program director, he asked me
Uh-huh.
about, hey, so how many cases, or how many, I will mention one surgery, laparoscopic cholecystectomy you made until this moment, okay? So that's a tricky question, because if you maybe say too little, so they say, okay, but this guy has been practicing for 4 years, for example, and he just made 100 cholecystectomy, that doesn't make sense, right? But nothing makes sense either that you say that you made 5,000. Okay,
Yeah.
so you need to be real, because that's gonna maybe helping you or can kill you during
Yeah.
the interview. And I remember, a couple years ago, I got a candidate that we asked that question, and he just shoot the answer like, no, yeah, 5,000. Okay, so that's hard to believe. And then I remember my program director, he asked a basic question about the procedure itself, the
Uh-huh.
cholecystectomy, and he didn't know how to answer. I said, okay, so how a guy that he made 5,000 cholecystectomy, he's not able to answer that simple question.
Simple
So
question.
that,
Yeah.
everything that you mention in the interview can help you, but at the same time, can make a really
Detrimental to
bad, yeah,
you.
it's going to
Yeah.
be detrimental. It's going to make a really bad impression about yourself. So be careful with that, please.
Okay. So because we're closer, you're already to half an hour, which is usually the time that we spend in the
Okay.
interviews. I would like to ask you something important that I also believe is, this is a very hard path full of obstacle, long hours of working, all these tests, long hours studying. So how do you manage your time with your family? You're married, you have kids. A lot of people have in the same situation like you. How important was the support system for you?
Oh,
And if you talk a little bit about that.
oh, absolutely. That's really important in this journey that we pick to do it. Okay, so all the time, as Jesus says, so I have a wife. She's not in the medical field, and I have 3 kids. Okay, so it's really hard to handle, honestly, because you want to balance the time that you spend in the residency additionally to your family. So the support that I got, it was tremendous. It is tremendous because she's continued helping me a lot. Okay, so I'm gonna say that she's a saint because she went through my first residency in Venezuela, and she's still with me during this second residency.
Yeah.
So honestly, she's a saint. And the support system is really important. So you to be concentrated in your residency, to go through all these obstacles that you mentioned, passing, trespassing every single step. Finally, make the criteria to apply for residency, make inside the residency program, and survive to
Yeah.
residency. If you don't have somebody supporting you, so probably you won't survive. So I'm really grateful that I have, my partner, my wife. So she have with me all the time. Okay, so she every single time that I request an extra time to maybe prepare for a test. So every single specialty, for example, has a test that they have to take every single
Mhm.
year, and you need to prepare to take that test. Okay, so don't just to give you a heads up, you maybe think that after you pass all the steps, the work is done. It's not done. So every single year, so you need to take a test in whatever specialty that you have.
Correct.
Okay, and after you complete your residency, let me give you the other news. So you have to take another test. That
Yeah.
is the board exam. Okay, and then in couple of years, you need to do the recertification, another test.
Correct.
So you need absolutely a person, a good person that is going to support you for all this journey. Okay.
Yeah, even in that part, our stories are similar because my wife is also she's not in the medical field either, and she went through my first residency. She's going through my second residency. Well, it's hard. It's hard because it's a lot of time, but it's the support system is very important for you
It
guys
is. It
having
is.
somebody that help you out, somebody that understand the path that you're taking, somebody, and it's also important to have people around that is going through the same thing.
All right.
That's why we have created this IMG community. That's why we are helping each other. So we have different groups on WhatsApp. We have events that we are creating with Project IMG. The IMG event that started in New York 4 years ago. Now we're doing here in Miami. We have done it twice. We're going to do it again in April next year. I'm inviting you guys to come. This is growing and growing. We are making changes even in the American law to to help IMGs to work in a better way to introduce in the healthcare system in a faster way as well. And I think this is just gonna keep growing and improving if we all work together.
Correct. Yeah, I know.
So,
It's
and
essential.
that's one of the reasons that I'm doing these interviews to IMGs, to residents from different countries. That I'm very proud that I'm able to sit here with a fellow Venezuelan. So this is a special YouTube video.
Thank you.
And thank you for again for being here.
No,
Thank you for helping me so much.
no, no problem. All
In
the
the past
time. All
way.
the time.
Yeah, and we're here to help you as well. So I hope you guys, one of you guys that are watching this video, will become a future surgeon here in this country, and maybe why not a future resident at Larkin Community Hospital.
Amen.
Thank
I got
you,
it.
and bye bye. See you in the next video.
Absolutely.
Don't forget to subscribe.
Absolutely. Subscribe. Remember that. Thank you again.